Did you know that more than 2.5 million Americans live with atrial fibrillation, or AFib, which is also known as an irregular heartbeat? Now, every hour, 15 people will suffer a stroke caused by AFib. That's why this morning we're taking a closer look at what atrial fibrillation is and how it could increase the risk of a stroke. And even more important, what you and I can do to partner with our doctors to reduce this risk of stroke for ourselves and for our loved ones with AFib. We have very special guests with us this morning. Let's start with Dr. Annabelle Volkman. We also have a patient, Susan Markman, and a caregiver, Lisa Clow. Ladies, good morning.
Good morning.
Good morning.
Thank you for being here. Susan, I'd like to start with you. Let's talk about, and if you could just kind of take me back when you experienced the AFib symptoms. What happened?
I woke up in the middle of the night on a Friday night, and my chest was throbbing, and it felt like it was going like that.
Oh my goodness.
I kept turning and turning. Nothing made it better. I got up, I walked the floors. Notice I didn't call 911.
No, you didn't.
Did not.
Were you
Didn't wake my
petrified?
husband. I think I was in denial. I think I just couldn't react other than in the moment to what I was feeling. I walked the floors. The next morning, I called my doctor Saturday morning.
Oh my goodness.
He asked if I was very stressed and anxious and suggested I go to an urgent care. I went to the urgent care and they thought I had a cold. 2 days later, I went to the doctor. He did an EKG in the office. Obviously, I had AFib and I went right to the hospital.
Susan, you are so very lucky.
Absolutely.
You had no idea you
Nope.
had AFib. Did you even
Nope.
know what it was?
I don't think, other than seeing a commercial on television, I had any idea what it was. Nor did I think it could happen to me.
Lisa, so lucky, but yet unbelievable story here. That's why I always say it's so important to be educated and to call 911 for that matter. Would you agree?
Yeah, I think especially from the caregiver perspective, it's so important to be educated because really, even if the AFib is being controlled, the stroke risk is being controlled, anything can happen at any time without warning. So you do have to be aware and educated.
My goodness. Dr. Volkman, let me bring you in now. Medically speaking, what is AFib exactly?
Atrial fibrillation can be caused by many different things, but atrial fibrillation not caused by a heart valve problem is the most common arrhythmia. Normally, the heart would beat synchronously. The upper chamber of the heart beats, and then the lower chamber of the heart contracts. In atrial fibrillation, the upper chambers of the heart no longer contract, and they quiver. And blood clots can form in the heart, and the blood clot in the left atrium can go directly to the brain, causing a stroke.
And we have a video which I believe illustrates this point. Let's take a look at this and tell me what's happening here.
So in atrial fibrillation, when the heart is no longer contracting, the upper chambers of the heart quiver. The upper chambers of the heart are called the atria, and blood can pool in the heart and cause blood clots, which can break off and go to the brain.
Unbelievable. Now, there are some really startling statistics I'd like to share with you. There's just a few. Number one, having AFib can put people at 5 times greater risk of stroke than people who don't have AFib. The second one, AFib causes 1 in every 6 strokes. And this one in 3 AFib patients will suffer a stroke in their lifetime. Doctor, can you explain to us the different kinds of strokes with AFib?
So 90% of patients get what we call ischemic stroke, in which a blood clot can break off from the heart and go straight to the brain. And when the blood clot blocks off the blood flow into that part of the brain cells die, and so you lose that function. That's why even a small stroke can be so devastating depending on where in the brain it goes to. So you cannot minimize a blood clot or a stroke in atrial fibrillation because you never know where it's going to go. And then the other 10% of strokes that can occur is the hemorrhagic stroke, the bleeding stroke, and those are we always have to weigh the risks and benefits of any drug that we give or any treatment that we give with the risks that they can have. I also want to emphasize that women are at higher risk of stroke when they have atrial fibrillation.
Really?
So women should be especially cautious about how they get treated for atrial fibrillation.
Susan, any advice or what would you tell people out there after what you've been through?
Well, anybody watching this would know I needed to do a better job advocating for myself. I needed to call 911. But I think more importantly, it's finding a really good doctor you can communicate with, taking medication as directed and taking it, and eating well and exercising.
Great advice. Now, we're not done. I have more questions for you, so please stay right there. When we come back, we're going to talk more about AFib and the risk of stroke. We're also going to discuss some misconceptions regarding AFib and learn how to tell if someone is experiencing the stroke. So stay with us. The Balancing Act will be right back. Welcome back, everyone. We're talking with Dr. Annabelle Volgman, patient Susan Markman, and caregiver Lisa Clow. We've learned quite a bit today about AFib and the risk of stroke. Doctor, as we continue to talk about this, you have a great illustration here regarding an eraser and a clot. Can you give us this example here?
So a clot as small as a pencil eraser can cause a devastating stroke. So it doesn't have to be big to cause a bad stroke.
And some misconceptions I'd like to go over, if you can give me some insight. I have a few. Here's the first one. Can you tell when you have AFib symptoms?
Not necessarily. Some people have silent atrial fibrillation.
Okay, here's another one. Is the biggest risk of AFib having a heart attack?
No, actually a stroke is the biggest risk.
Okay, does AFib primarily affect men only?
No, women can get atrial fibrillation. As a matter of fact, after the age 75, there are more women who can be affected by AFib.
And here's the last one. Does AFib only affect the elderly?
No, it does go up with age, but anyone can get atrial fibrillation as an adult.
Okay, and how do you determine the risk of a stroke with AFib for a patient?
There are certain risk factors that doctors calculate. On a score of 0 to 9, we use the scoring system called Chad's VASC,
Okay.
which takes into account gender. So women have more strokes, so that's an important risk factor. Hypertension, elderly, age is a risk factor. Having diabetes, having had a stroke is a big risk factor, or a TIA. And then artery disease is another risk factor.
And what about warning signs? Because Susan experienced some, so what are some warning signs to look out for?
There's an acronym now that is so easy. It's called FAST, F-A-S-T. You got to act fast. So
Okay.
F, you ask somebody to smile, and if a part of their face is drooping, one side of their face is drooping, that's a sign of a stroke. Another, the A is for arm weakness. So go like this, and if your arm, one of the arm moves down, that's another sign of the stroke, because that's an arm weakness. S is for speech. Ask somebody to say a phrase, and if they can't say it right or if they slur it, that's another sign of a stroke. T is for time to call 911. If any one of your loved ones, or if you're experiencing something like that, call 911, because that's a sign of a stroke.
Susan, you're smiling. Great information and makes you think, right?
Right.
Unbelievable. Great stuff here. Lisa, we also talked about education and partnering with your doctor. Why is that so important?
Well, it's so important for caregivers to be educated, like I said before, because you just don't know, even when things are being controlled. It doesn't mean the person you're caring for still can't go into AFib or still develop stroke symptoms. And one of the best places, especially women can go to get a lot of free health information about AFib and stroke risk, is Women Heart, the National Coalition for Women with Heart Disease. The website is womenheart.org. There are quite a few informational pieces on there that can easily be downloaded. There's also a video that talks about women in AFib and stroke risk.
Susan, I want to end with you on a high note. Some last words from you?
Well, truthfully, I feel great. I really do feel well. But when I listen to the information that's here, I hope people are listening. I hope they're aware. Hope they're paying attention. And if there are any issues, call 911.
Thank you all for coming by. I really do appreciate the information, Dr. Lisa and Susan. Thank you so much for sharing your personal story. Really do appreciate it. And for more information on these health-related topics, visit us at thebalancingact.com. That's thebalancingact.com, or let us hear from you. Log on to Facebook /The Balancing Act Fans.